Hello everybody, it's Wednesday, January 6th, 2021. Happy New Year! It's my first video of the new year, and I'm happy to tell you that we are still COVID-free among our residents. We did have one positive staff person test on Monday. We tested all the residents yesterday in the health center and assisted living, and everybody's test came back negative. So that's awesome. Again, kudos to the staff for wearing their PPE correctly and washing their hands and doing everything we need them to do to keep this virus away from the residents. I'm so grateful that we have skated by again in our 10th month now of this darn pandemic, and we're all so tired of it. But we have started to vaccinate people. So we have vaccinated round one of the Pfizer vaccine went to all of the health center and assisted living residents, and approximately, I don't even know how many, at least 60% of the staff. And then we did a clinic with the Moderna vaccine from Public Health. We had 200 vaccines, and so we gave 160 more vaccines at that clinic. No, 140 more vaccines at that clinic. And we're having another clinic tomorrow with 60 more vaccines. So as of tomorrow, we are out of vaccine and we're waiting for another allotment. So we will have vaccinated almost, well, the oldest independent living residents, so 85 and up, 120 people almost. So we're making our way through independent living as fast as we can. The problem I'm having right now with public health is that allotments were based to the counties based on population, of course. And Johnson County is the biggest vaccinator because of the University of Iowa having so many hospital employees. But those employees don't all live in Johnson County. And so some of the vaccine went to the counties where they live. And so there is extra vaccine in all the little counties around us, and there is a shortage of vaccine in Johnson County. So just today or yesterday, I can't remember, my days are running together, I offered to get in the Oaknoll bus and drive around the state of Iowa and pick up all the extra vaccine just so that we could have it. I don't think they're going to take me up on the offer, but they need to go around the state and pick up the extra vaccine in the little counties and bring it to Johnson County. So whenever that happens, we will get an allotment. I have been reassured twice now, enough vaccine to vaccinate all of our independent living residents, whether they live on campus or not. So residents and residents not in residence. If you've signed a life care contract, so Oaknoll East residents, whether you live here or not, this does not include waiting list people. Waiting list people are on the waiting list, but they are not Oaknoll residents. So you have to be an Oaknoll resident to get a vaccine, or a staff person. So at my last count for Oaknoll staff people, we are at about 87%, and we will be over 91% when the second Walgreens team comes back on January 19th. There were a number of people out of town and unavailable at the first clinic date. So I'm really happy about that. And I think all the education that we've been doing is really helping the staff make a good decision about the vaccine. So I'm very, very pleased to report that. 91% of our staff would be great, but I'm still shooting for 100%. So some people have asked me why we are not mandating vaccines for our staff, and there are a couple different reasons, but it is still under the emergency use authorization, so it's not actually approved by the FDA. It's an emergency use right now. That's just a technicality, though. I was hoping that it would be approved. The other thing is that I would rather not have to mandate it to get people to use it. I would rather have people get the education and have the confidence to get the vaccine of their own accord and not have me force them to get a vaccine. That doesn't seem good to me. I would rather sit down and meet with people individually, and that's what I've been doing, one-to-one meetings with people. First I did group meetings, now I'm doing one-to-one meetings, and every time we have a clinic, before the clinic, I will meet with people again, and I will continue to meet with people until we have 100% or close to it. There are always going to be exceptions, even if it was mandated. There are requirements for religious exemptions and medical exemptions. And so there are always exceptions to every rule. And so we might not ever get to 100%, but we intend to get as close as we can. So that's my vaccine update. I don't have any resident refusals for the vaccine yet, so bravo to you. That's very exciting. What else do you want to talk about? Vaccines, we talked about COVID. I don't know. Changes. So I do want to make this point loud and clear. We are not changing any of our mitigation strategies post-vaccine. So on the day we had our vaccine clinic, I got grabbed by 2 people who were enthusiastically hugging me after the vaccine. And I loved it. I'm a hugger, let me tell you. But we can't hug yet. We can't take off our masks. We can't stop socially distancing. We can't dance in the street together. We can't do any of the things we want to do just yet. We have to wait until we establish some criteria so that it's safe. So I don't want to ruin all of the good work we've done for 10 months. Because we're so excited, we sort of wreck it at the end. So just be patient, get your vaccine, let your antibodies build up in your system, let the general public start to get vaccinated. There's a lot of vaccine hesitancy in the general public if you think it's bad among the staff, and it's 9%. Just look around you. It's very bad in the general public. There's a lot of baloney on social media, and I'm hoping it will get better. At the end of January, but I don't 100% know for sure. I'm just hoping. So all we can do is educate, and keep your safety measures in place. And there'll be lots of hugging at the end of the summer, I suspect, and dancing and barbecues and parties and wine and chocolate and I don't know what else, but lots to look forward to as we get vaccinated. But we're standing on the precipice of success, and we're the Lone Star now. Johnson County held strong for a long time, but we are one of very few communities who hasn't had any cases. And so I just worry about us being careful and mindful that we're still greatly at risk. Johnson County positivity is going up. It's going in the wrong direction. It was 10.9% on Monday. And so just be careful out there and call me if you have any questions. But I'm still very optimistic that we're going to beat this COVID thing, and we're going to look back in another year and we're going to say, remember when we thought it was inevitable? We thought it was inevitable that we would get sick. And it wasn't. It wasn't inevitable so far. So knock on wood. Have a great week. I'll see you in 2 weeks. Bye.